Good evening, Mr. Alcantara. My name is Walda Taveras. I'm going to be your provider today. Today we're going to do a head-to-toe assessment. This is just going to check from your head all the way down to your toe, all your system, to make sure that everything is okay and there is no abnormalities. Is that okay with you?
Okay.
Okay. Can you just tell me your name?
Manuel Alcantara.
Perfect. And can you tell me your date of birth?
May 7, 1983.
Okay, perfect. Do you know which day is today?
June 30, 36.
Perfect.
2026.
Yes. Do you know who's the president of the United States?
J. Trump.
Okay. All right. And do you know where you are right now? Where we are?
Doctor office.
Okay. And you know which state you are?
New Jersey.
Okay, perfect. All right. So we're gonna start from the head. But first I wanna take all your blood pressure and make sure you, everything, your vitals. Okay.
Okay.
All right. So just let me. Okay, Mr. Alcantara, your blood pressure is really good. It's 122/70. Okay.
Okay.
That's considered normal. I just gonna check your temperature. 97.1, and then your oxygen, and at the meantime I'm gonna check for your respiration.
What do you see?
It's okay, just relax. All right, your oxygen is 99% and your pulse is 63.
What
All
do
right.
you see?
Okay, now can you tell me how tall are you? How tall are you?
5'11".
Okay, perfect. And then our secretary weighed you, and you weigh 210 pounds. Is that accurate?
Mm-hmm.
Okay, perfect. All right. So the next things that we're gonna do, as you see, we have different equipment here to check on your ears, your eyes, and to check on. I will explain as I go. Okay. So first of all, I wanna check on your face. And I see your face is oval, and then your skin look very moisturized, and then have some fair hair with some spot in the hair. Your hair is look full except for this spot in the entrance. It might be starting of alopecia. Okay, you have some gray hair mostly in the back, and then the skin look moisturized, a little bit on the greasy side, some grease on your face. So do you usually have grease during the day? Yeah, so it's good, like if you keep it clean, try to wash it 2 or 3 times a day. The forehead look symmetrical. The cheekbones, you can feel it, but the hair cover it. And then the nose looks symmetrical. The eyes look symmetrical. The eyebrows are symmetrical, a little shorter than normal, and then you can see some gray hair in the face. Okay. All right. So the next thing I want to do is I want to check in your ears.
Okay.
And before we check on your eyes, I'm gonna check your temporal pulses right here. Okay, pretty well. I can feel it in both sides. And then I'm gonna check what it calls cranial nerve. So some of them, I want you to clench your teeth, clench it like that. Okay, smile. I want you to put your head up, yeah, like that, exactly. And then you put your tongue out and move it side to side. All right, perfect. That's good. And then now we're gonna check. I'm gonna check on your eyes. For that, I have this line here. First, I'm going to check if your eyes are look good. Okay. No redness. Conjunctival look pink and moist. No discharge nor in the eyes. So I just want to look forward to me. No, keep your eyes on. Okay. Okay. All right. Everything looks okay. And now I want you to follow this pen. Okay. Now I want you to tell me when you can see the pen.
Yeah.
Okay. Alright, pretty good. Now, this is called the confrontational test. I want you to cover one eye, and you look at my face, and then you tell me how many fingers I have. Okay, perfect. Now, cover this one. Keep looking at me, and how many fingers I have?
3,
And how many fingers I have?
4.
Alright, perfect. Very good. Now the next things I want to do, I'm gonna check just look forward for me. All right, pretty good. And then I'm going to do a ophthalmoscopy test, and I will be using an ophthalmoscope in this case, and then I'm gonna check. I wanted to check if the fundus through your retina. Okay, so look, just look. Okay. Okay. Now we're gonna do a test called a Snell test, and then I'm gonna show you letters, and I wanna see your visual acuity to see how you can read from far. Okay. All right. So. Wanna tell me the letters here?
W, A, F, O, I.
All right, perfect, very good. And now, can you read this sentence for me?
The follow rubric will be used to score this assignment.
All right, very good. Thank you. All right. Now, Mr. Arcangelo, these things I wanna touch in part of your face, and I want you to tell me if you can feel it. Okay? Can you feel that?
Mm.
Can you feel this?
Yeah.
Can you feel this? Okay. Now I'm gonna check on your sinus. Okay. Any pain? Any tenderness?
No.
No tenderness? Okay. Alright, Mr. Okay. Alright, so we're gonna move on to the nose. I'm gonna check your nose, okay? So first if you can breathe out. Do you feel any cloggedness? No, not clog. Alright, I'm gonna turn off the light for a minute, and then we're gonna check on your nose. Look up a little. Sinus are good. Alright, very good. Now the next things I'm gonna do, I have something here, and I want you to smell it and let me know what you smell. Close your eyes.
Coffee.
Alright, perfect. Okay. Alright. Are you having any discomfort in your nose?
Mm-hmm.
No? Okay. Okay, Mr. Alcantara, we're gonna continue with the mouth. Now, if you can open your mouth, please. All right. Okay, so it look pink and moist, nice and pink. Open up. Alright. Tonsils looks good. Okay. Everything, the fingers are, everything is good. Okay. And the next thing we're gonna check is gonna be your ears. Okay. So we're gonna do a couple of tests, and I'm gonna start checking your ears outside. So it look, pinna look on place, and you look symmetrical. Skin look moist. Okay. And no discharge. So with this, I'm gonna look inside your ears, okay? All right. So the tympanic membrane look intact, pearl gray color. You can see the reflection on the comb. Doesn't look bulgy or redness, and no inflammation noticed, and not wax noticed. Okay, I'm gonna do the other side. Okay, pretty good. This side also too. The tympani look pearl gray. No inflammation. Notice. And the cone look reflection look okay, no wax, nothing. Okay. The next thing I'm gonna do, I'm gonna check to see your hearing. Okay, make sure if you hear okay. Alright, so I'm just gonna tell you
99. 99.
Alright, that's what they call the whisper test. And then we're gonna do 2 more tests called the Weber test. Is the rhyme test. It's just gonna check if you have any sensory or conductive loss, hearing loss. So first I'm gonna do this one, and you're gonna tell me if you hear in one side, the other side, or if you hear equal in both sides.
This side.
You hear it more this side?
Mm-hmm.
You cannot hear in this side?
No.
Oh, okay. What about now?
Both.
In this side only?
Mm.
Okay, so you might need reference to the, what about now? Only this side?
Mm-hmm.
Which side? Okay. So we might need to refer you to an ENT doctor, okay?
Okay.
Okay, now this is another test for your ear. So what we're gonna determine if it's sensory or conductive your hearing loss. So I'm gonna put it here in the front and in the back, and you let me know if you will still hear it when I put it in the front, okay? When you stop hearing it in the back, when you stop, you tell me, and then if when I put it in the front, if you still hear it, okay? Stop.
Stop. Stop.
You hear it when I put it in the front? Yes. Okay. So you tell me when it stop, and then when you can hear it, if you can hear it in the front still.
Stop.
Mm. You hear it?
Mm-hmm.
Stop.
Mm-hmm.
Or no? Stop. You still hear it?
Yeah.
Okay. All right. So we might need to refer you to the ENT doctor. Okay. All right. Then Okay, Ms. Arcanda, now we're going to check your neck, and within your neck I'm going to check your thyroid, your trachea, and your pulses, okay? So the skin look asymmetric, moist, no redness and no discoloration, no dark spot indicating diabetes. Okay. All right. So first of all, I'm gonna check your palpate for any. Okay. I want to check your pulse. Okay, now this one. Okay. Now we're gonna do a test for your thyroid. So first of all, let me just check it. Okay, tracheal, okay. Okay, trachea look in place, midline, no desviation notice. So the next thing I'm gonna do, I'm going to give you a sip of water. You're gonna tip your head down, and then I let you know when you're supposed to swallow. Keep it in your mouth, and I tell you when to swallow. Look down. Wait a minute. Okay, swallow. Oh, okay. One more. Swallow. Okay, perfect. So no noodles observed in the thyroid. Now I'm gonna listen to your cardiac pulses.
This is the letter E. Or elephant. This is the letter E. Or elephant. This is the letter E. Or
Okay, very good. Everything looks good. The next thing I want to do, I want to check the flexibility of your neck, so you can move it side to side. The other side. Back and forth. Back and forth. Back and then forward. And then if you can put your head in your shoulder like that. This way. Okay, perfect. Alright, Mr. Alcantara, the next thing we're gonna do is I wanna check on your chest. First of all, your skin look very moisturized, equal in color. It looks symmetric. The chest looks symmetric. You have some obesity belly, protruded belly. Yeah, we need to work on the diet and exercise. So some hair, gray hair in the middle, and then the skin, no discoloration, and no lump needed, no rash, knotted. The next thing I'm going to do, I'm going to check on your. Let me know if you feel any tenderness. You feel any pain?
No.
Okay. I don't feel any lump. Okay. All right. So I'm gonna do a test called Fremitos, and just gonna check for any consolidation, okay? So I want you to say 99 when you feel my hands, okay?
99. 99. 99. 99. 99.
Okay, very good. And I'm just gonna check for. Okay. Let me check from your ribs. Okay. You have any tenderness?
Mm-mm.
Okay. Alright. The next thing I'm going to do is I'm gonna check on the back. You can this way, let's say. And then I want you, when you feel my hands, I want you to say 99, okay?
Mm-hmm. 99. 99. 99.
Okay.
99.
Alright. I wanna listen to your lungs, okay? Take a deep breath. Take a deep breath. Okay, let it go. Relax. Take a deep breath. Deep breath. Take a deep breath. Okay, let it go. Deep breath. Let it go. Take a deep breath. Let it go. Not just. Then just. Okay. All right. Right. The next thing you know, we're gonna do a test just to check for any consolidation on the lungs called egonophrine. So I want you to say the letter E when you feel my stethoscope, okay?
Mm.
E.
E. E. E. E.
One more.
E. E.
Everything looks good and normal. Okay. Okay, Mr. Alcantara, now we're gonna lay down. I'm gonna check, let me put this pillow on here. I'm gonna check on your heart. This is your PM. I'm gonna check the tone or maximal expression of your heart for PMI, and it's in the fifth ribs mid clavicular, so it'll be right here, okay? And then I'm gonna check your perineum. Okay. I wanna check on your jugular vein. So the thing I wanted you to do is like, I want you to extend your neck, and I want to look in that side. Look to the side. So that's what he meant when he said. Okay, this side. Okay, and next. gonna listen to your chocolate baby. Look. Okay. Okay. Your heart sounds very good. Okay. Now the next thing we're gonna do. And so right now we're gonna check your arms. Okay. So see your elbows. The skin look moist and equal, no rashes, no discoloration, no nose spiral or sinuses, no jaundice, no clubbing in the fingers. This capillary refill is done too. All nails look pink in color. Fingers look, palm looks pink in color. No discoloration noted. Now your shoulders are symmetrical. Skin looks normal, moist. I want you to push up. Okay. All right. Perfect. I want to put 1 and then 2. Okay. And then on your elbow, flex and out. Okay. Up and down. Okay. Now push up. Okay. Push down. Very good. Now this one. Okay. Elbow looks moist. No dryness notice. Up and down. Up, up, up. Put your feet up, down. Now push up and push down. All right. I'm gonna do a test. This is to determine if you have any problem with the carpal tunnel. So you let me know if you feel like numbness. I like pins of needle on your fingers, okay? When I press. Do you feel pins of needle? Let me see that. Okay. Okay. And then I want you to put your fingers like that. Do you have any pain or discomfort?
No.
Okay. So I'm going to move your thumb. All right. Very good. Okay. All right. And then all right. Now we're gonna check on your abdomen. Okay.
Okay.
Okay. Before we lay down, I'll check on your costo vertebra. Okay. So no barrel chest noted. Abdomen is little distended for central obesity. Okay, you can lay down. Okay. The skin look normal, color is normal, no discoloration, no redness. Okay, and the soft touch. Listen. Positive bowel sounds. Positive bowel sounds in 4 quadrants. And I'm gonna check for venous home. and then we're gonna check for liver contact. No, está me dando feel. Do you have any tenderness?
Mm,
No. You have any tenderness?
No.
No. It hurts when I press here?
No.
Okay. Do you have any pain here?
No.
No. Mm. No pain?
No.
Okay. Okay. And then okay. And Sacandra, Leslie, we're gonna check on your lower extremity. First, I'm gonna check on your pulses. So, we're gonna check on your pulses here, positive. Good. And two pita pulses. Oh, okay, perfect. Now I'm gonna check your poquito pulses. Okay, very good. Perfect. Okay. So the skin on the extremity, it look equal in color, a little bit dry. And then we're gonna do a couple of tests. First of all, let me know in which side you feel right or left the touch.
Right.
Okay. Now.
Right.
Now.
Left.
Okay.
Right. Left.
Okay. The next thing I want you to, with your heel, I want you to touch your chin right here. With the heel, you touch the like that up. Okay. The same thing in this side. This side. Alright. Perfect. Okay. And the skin, the toes is normal. Capillary refill is done too. As you have a lot of dryness, very dry skin on the feet. Okay, now I want you to put this up, straight up, and then, okay, perfect. And now put it up. Don't let it put it down. Don't let me put it down. Don't let me put it down. Okay, this one up. Don't let me put it down. Don't let me put it down. Very good. Now, push to me. Push forward. Okay. Push back. Okay. Very good. Now, flex your knee. Okay. This one. All right. Very good. Okay. All right. And now, okay, Mr. Alcantara, we almost done with the test. Thank you for cooperation. And then I just want to do some neurological tests. So the first thing I want you to tug your nose with your fingers. Nose with the fingers. Okay, back and forth. Nose, finger. This side too. Okay. And now I want you to flick your hands fast like that. Fast, fast. Okay. All right. Perfect, very well. Then let me know, do you feel this?
Yeah.
Can you feel this?
Yeah.
Can you feel this?
Yeah.
Can you feel this?
Yeah.
Okay. Now, you're gonna tell me if what you're feeling is soft or it's rough.
Soft.
Rough or soft?
Rough. Soft.
Okay.
Rough.
Okay, perfect. All right. And I think everything looks normal. just a couple issue with your ears, and maybe you need to see an ENT, and then you need to take care of your feet. There is a little dry skin, and other than that, everything looks normal. Your lungs and your heart, okay?
Okay.
Mm-mm-mm.